I had a dream in 2009, and it's come to fruition today. I wanted to take health, women's health, to the women of South Africa. And with our unit that we launched today, that dream has been realized.
I'll take it in, but don't look down. 'Cause I'm on top of the world, eh? I'm on top of the world, eh? Been waiting on this for a while now. Paying my dues to the dirt. I've been waiting to smile, eh? Been holding it in for a while, eh? Take you with me if I can. Been dreaming of this since a child. I'm on top of the world.
It's really awesome to see everyone here. Our next speaker is Dr. Ashwin Haribuns. Please welcome him to the stage.
This project started 5 years ago with an idea conceived in a board meeting, and I wish to pay tribute to fellow board members who cottoned on to trying to see to what extent we can extend ourselves to complete the picture when it comes to breast cancer. And today we have a new addition to the family. And ladies and gentlemen, join me in christening her Knowles, in tribute to Nolene Cochin. This new program will look at assisting government in ensuring that all women have access to general medical examinations at the most basic level, so that if we can pick up any risk factors for any illnesses, not only for breast cancer, but most certainly for the ones that are dread, as reported in our own medical literature, breast cancer and cancer of the cervix. And let us join together and make sure that the mothers, the sisters, the grandmothers, the great-grandmothers, the future mothers are all protected against this dread disease.
And so, what legacy are you leaving behind? What legacy do you want to be known for by my generation? As sponsors in government, you are in a unique and privileged position to leave a legacy to children like me who could experience the pain as a result of breast cancer. And so I challenge you and I plead with you to get involved with breast cancer and change the destiny of thousands of children just like me.
When early detection saves lives, PinkDrive educators and clinical staff communicates a message of hope every time they move into action. Getting out there and doing something is what PinkDrive and Bitvest is all about. Cancer is a killer, so is ignorance, and so is apathy. And just think about it, if each of us go out with the knowledge we have and we save one more life, and that saved life saves another life, we might just be able to eliminate this dreaded disease. Education is the most powerful weapon which you can use to change the world. Let's go out and educate. Thank you.
Women in Africa suffer in many cases from non-responsive health services, but perhaps what is more disturbing is the fear and stigma associated with cancer. Our women suffer from being discriminated by communities, ostracized by their partners or husbands, and have to face premature deaths from breast and cervical cancer. I'm therefore particularly excited at this initiative launched by the PinkDrive and its partners, that being the South Africa's first women's health mobile mammography and gynecology unit. My wish is to see us all come together to support and empower each other. South Africans, and South African women in particular, have a generosity of spirit that I'm yet to feel anywhere else in the world. And if we all extend our hands to help one another, we can overcome all the challenges that face us.
It is unfortunate, Program Director, that the majority of our women folk are still bearing the brunt of poverty and rank high among the unemployed and the underemployed. It is for this reason that I stand in front of you today with overflowing joy at the discernment of the change and culture shift that is about to occur through the establishment of South Africa's first women's health mobile mammography and gynecology unit. In supporting this auspicious occasion, I wish to highlight that we as a collective and individuals sitting here today are saying, let us make it our responsibility to test for cancer. Let us remember that, as the First Lady has just said, prevention is better than cure.
Ladies and gentlemen, the Pink Drive is one of the beacons of hope for thousands of women who will benefit from mammograms that will be conducted in our public health facilities. I therefore take this opportunity to laud this initiative because it will bring breast cancer screening closer to where people live. The people who will benefit from this enterprise would have had no access to this service. Breast cancer is the most common among cancers which affect women. More than anything else, early detection of breast cancer is crucial for the successful management of the condition. Therefore, the Pink Drive will be a decisive intervention. In conclusion, on behalf of the Gauteng Department of Health and the Gauteng Provincial Government, I pledge our full and unwavering support to the fight against all diseases facing the poor.
The Pink Drive is like become my little baby in government. So I have to dream pink, sleep pink, and having Nolene on your back, you know, she's gonna make sure you work and you work very hard. Then somebody asked me, okay, so Deputy Minister, you are for women, children, and people with disabilities. So what's it with Pink Drive? I'm like, wow, I never thought that question will ever come. Breasts, it's about women. That's our business. And those breasts, as MEC have already said, are supposed to feed children. That's our business. And cancer causes disabilities. So that's our business. So my dear, those three people are our business, and making sure that they don't acquire any of the cancers remains our business. Besides the truck, and where the truck can't reach, Bidvest fly Pink Drive into those rural areas. So they deserve a very big hand of applause. So we're saying to all the young women, and to all the men, and to all the women, and to all the children, our responsibility is keeping South Africa healthy and alive. And our message is, please go out, raise that money, get the trucks on the road, but do your early detections so you can stay alive. Thank you so much.
So I want to congratulate the Pink Drive team for your progress and success. I was with you some few months ago at Natal Spruit Hospital, and I was very encouraged that you do not work vertically alone, but you work together with the health institutions, screening and referring and looking at the support of the patient throughout, especially those that have been found to be positive of cancer. Those affected, as they are part of us, we will support you. It is not only your problem, it is all our problem. I thank you.
I don't believe there's anyone in South Africa who comes close to what we, our staff, and our loyal business sponsors have achieved in 50 months. We've now progressed from breast cancer to addressing the second biggest cancer killer in women, cervical cancer. I'm in discussions with partners to address other women's health issues. So watch this space, hopefully in the next couple of months, for HIV/AIDS testing, TB testing, and other silent killers in women. And if government would like to provide us with the HPV, we can help you go into schools. We can help you do and address the problem. And now, I'd like to ask the First Lady, the Deputy Minister of Women, Children and People with Disabilities, the Deputy Minister of Health, Alma Berger, Kirshni Govender, to join me at the formal unveiling of our triplet.
Can you get one last shot of me just hold the ribbon?